Can I come in?
Yes.
Hello, my name is Amanda.
Hi.
We'll be doing a comprehensive assessment today.
Okay.
Can I get your name and date of birth?
Yes. Andre Hart.
Mhm.
My date of birth is August 21st, 1996.
Okay, perfect. So before we get started, do you have any questions?
No.
Okay. So first, do you have any allergies?
No, I don't.
Okay. And then what's your height?
6 foot,
And then your weight?
185 pounds.
Okay. And are you have you had your immunization for pneumonia?
No.
No? Okay.
I don't think so.
What about your last flu shot?
Probably 2 years ago.
Okay. You know, like the month maybe?
October, November.
Okay. Okay, and then TB shot? Have you ever had one?
I have had one before. I can't remember my last one though.
Okay. And what about shingles?
Yes, I've had. I think I've had that shot before too, but again, I can't remember when.
Okay. Okay, so now we're going to get into your current health as well as people in your family that might have had it. So
Okay.
starting with arthritis, have you or anybody in your family had arthritis?
Not to my knowledge.
Okay. What about any type of blood disorder like anemia, clotting, bleeding, or blood transfusion?
Not to my knowledge.
Okay. What about cancer?
No, not to my knowledge.
Okay. Diabetes?
Yes.
Yes. And then who has diabetes?
My grandmother has had it before, or has had it on my mom's side.
Okay.
My
And
mom
then
had gestational diabetes before. And I think there's more people that have it as well, my mom would always say, but I don't know exactly who, but yes, it is in the family.
okay. And then do you know what type your grandmother had? Do you know if she like had it since birth or she got it later?
I think she got it later, but I'm not exactly sure.
Okay. And do you know what she does to treat that? Like check her?
I know she checked her blood a lot, prick herself, and test the blood.
You know if she takes any medication for it or no?
I feel like she probably does. She has a lot of medications. I'm assuming one of those are for that.
Okay. All right. So now we're moving to vision problems. Do you or anybody in your family are nearsighted or farsighted with glasses or contacts, have cataracts or glaucoma?
Yeah. My mom wears glasses. I'm not sure if she's nearsighted or farsighted though.
Okay.
But I know she does have vision trouble. And then, yeah, my dad wore glasses before, but I mean, I don't think it's a necessity because he doesn't always wear them. I don't know him to wear contacts, so. But mom, yes.
Okay. And then nothing to cataracts or glaucoma?
No.
Okay. Hearing difficulties, anybody wear like a hearing aid?
No.
No. Okay, any nose or throat problems?
No.
No. Any cardiac problems? Anybody getting cardiac arrest or arrhythmias?
I don't think so.
What you think of? What about high blood pressure?
I think my grandfather had high blood pressure.
Okay. Do you know if he takes anything for that or you're not sure?
I'm not sure.
All right, what about respiratory? So emphysema, asthma, bronchitis, TB, or pneumonia?
No, I don't think. No.
Okay. Strokes? Anybody had a stroke or you had a stroke?
No.
Anybody had a peripheral vascular disease, so like lymphedema, varicose veins, deep vein thrombosis?
No.
Okay. And then GI, abdomen, so ulcers, IBS, or Crohn's disease?
No.
Okay. Any neurological problems?
No.
Musculoskeletal, so somebody use assistive devices, splints, or braces?
No.
Okay. Skin, hair, and nails problems, so like shedding, frequent shedding, rashes on the skin?
No, no rashes.
Okay. Any chronic infections from you or anyone in your family?
No.
Okay.
Maybe shedding. I mean, like my granddad's well.
Okay. So yes. You think that would be more due to age or?
Yeah, maybe age.
Okay.
Yeah, it's just normal aging and stuff.
Mm-hmm. Okay. What about psychological mental disorders? So like depression or anxiety?
Mm-mm.
No. Okay. Do you use alcohol?
Not on a regular basis.
How much would you say per day or week if you had to?
Once a week.
Once a week. Okay. And then what type?
I mean, if I'm going out, it's different, but like I would say, just
Like hard liquor?
once a week, probably that.
Okay.
But usually I drink wine too.
Okay. Now, how long have you been drinking? A couple years.
Yeah.
Okay. Then do you use drugs?
No.
Okay. And then do you smoke tobacco?
No.
Okay, so that's all for that portion. I'm gonna go ahead and get your vital signs
Okay.
and physical aspect of the comprehensive exam.
Okay.
Okay, first I'm gonna take your temperature. Okay, lift up your tongue. Okay. Let's take your pulse first. And that thing will start beeping up when it's ready.
Mm-hmm.
Okay, now I'm going to take my temperature.
Do I have a few?
Nope, 97.6. Just trash?
Yeah.
Oh,
It's
just
trash.
trash. Just trash.
It's both trash. That camera's super clear though, for it to be this far.
I know. You turn it this way. Yeah. That's tight.
Nah, it's,
Okay. You wanna hold this one?
yeah.
Thank you. But try not to cover the. There we go. It's 122/68.
Did you do grandma and granddad?
No, I couldn't. Okay. Hold on, let me see him. And then if you're in, describe your pain. 0 being no pain at all, 10 being the worst pain you ever felt. How are you feeling today?
No, I'm fine.
Okay.
Good.
Yeah. Okay, so now I'm just gonna start starting with your skin. So I'm gonna feel around your face. Let me know if you feel any tenderness in any areas. Is that it all?
Nah,
Your ears.
maybe a little bit.
Actually look good. You really not supposed to clean with anything but a washcloth.
Oh, okay.
Okay, then open your mouth by eye. Lift your tongue up. Good. And lean your head back again. I'm looking to your nose. Good. Okay.
Any boogers in there?
Yeah, you're good. Look at my left ear. And I'm gonna shine the light. Good. Okay, opposite. My right ear. Good. Okay. Okay, let's get hands. And now you might. Does this go up?
I think it does. It's Dad's old chair.
Oh yeah. Okay, good.
Oh, yeah.
I'm gonna have you do your I'm gonna have you go in there. It's just a second. Okay. So I'm gonna listen to your breath sounds. Is it as straight as possible? No. Just breathe in and out. You can do the same thing anteriorly. So just go ahead and breathe again. I'm gonna listen to you by side. Sounds good.
Do you use the Breathe app on the Apple Watch? I try to do that every once in a
Yeah.
while, too.
I do.
Well,
When you
like,
start
I even
getting
wanna
mad, you
breathe
just
this.
that breathe. I get
Yeah,
all
right.
mad. Like, okay, I'm
But
gonna listen to your heart sounds.
It's good to just take deep breaths.
You have to bring extra. You just
Okay.
Just listen to your heart.
On like bigger people, do they make y'all like? If I was like really obese, like
You have
could
to lift up your skin.
Yeah, I was
Or like people with big breasted, you have to lift up the skin.
for real.
Yeah.
That's
But excuse me, can you?
wow.
Yeah, I wouldn't do it myself. I would have
Is this recording now?
Mm-hmm.
Oh, it is.
But it's
Oh,
okay.
man. All right.
This is like a real setting. They'll be asking questions. I know. I when I get to a doctor, I ask
Yeah,
questions.
that's crazy.
Okay.
Can't wait for the gyms though. Oh, outside of that, I don't even care for saving money. Everything.
I bet. Oh, you can go ahead and lay down. I'm trying to see. You might want to put your feet on this side. It might be
Yeah.
easier to see. Yeah. Okay, so now I'm going to assess your range of motion. Okay. So I'm just going to move your leg and you just let me do it. So first I'm going to your chest. And you twist on the side. Good. Straight in, twist in. Good. Tip away. Good.
Can you really get the other side? Go ahead and flip around.
No, you're good. I'll make it work. Towards you. Good. Other way. Good.
I'm not that flexible.
I know.
I'm not gonna lie.
It's not bad. I'll get your foot. I'll take your shoes off for you. Mm. Can you see this? Oh, I can't see.
Oh, I can't see. So I don't flip around.
No, I just have to move it over. That's good. It just. All right.
see that, but
Okay, now I'm gonna.
it's gonna be kind of hard to move. Be careful.
Yeah, I'm being very careful.
'Cause
There
the
we go.
TV is kind of like heavy, and there's nothing under it, so that's why it's hard to drag. in there. Like,
I got it.
it's easy if you lift the TV up, but I know you're trying to do all that shit.
Yeah, I know. Okay, go ahead and push towards me.
Oh,
Push your feet
towards
towards me.
you.
Yep, perfect. Okay. And laying down, listen to your bowel sounds. See what's going on.
Oh, man.
Got some action. Hey, hold on, I can't hear you. What'd you say?
I said I had to do a couple of them too.
Okay. I'm gonna let you palpate. Just let me know if you feel any discomfort. Nothing? Okay. You have any tattoos or piercings?
This one's in too.
Okay.
Gotta get sleeved up this year though.
Oh, gosh. And where's your tattoo?
Left arm.
Have you had any, like redness or irritation at
No.
all?
Healed perfect.
Good. Okay, now I'm gonna, this might tickle a little bit, but I'm gonna test your reflex. Try to do this as natural as possible.
My feet kind of rough, so I mean, I even feel this. Am I
That's
supposed to be
okay.
doing something?
No, they're not doing anything, but that's okay. As long as they don't do a certain thing.
Do it
There it is, there it
It
is.
took a little bit.
Oh, that was ticklish.
Yeah.
You're good. Okay. Now you go ahead and sit in this chair. And we're gonna let, I know you'll probably still be tall. I'm trying to measure your, is that as far back as you can go? Like on the chair? I was
Yeah.
gonna try to get, I'm trying to get your, reflex on your knee.
Oh, you're trying to get my feet off the ground?
Yeah.
Oh, that's not gonna work with this. I could hang over that, but then there's no way for you to.
Yeah.
No, I'm saying. Well, actually, hold on. If I like, come on, dangle my feet. Well, you're not gonna get that on camera though.
No.
Yeah.
Cross your feet. Let's try that. Cross your knees.
I
You
can't
can't even
do
do that.
I can just try to.
Yeah, just try to look.
I can like do like this.
There we
like
go.
that with it.
Trying to figure this out. Yep.
You gotta do the other one or just one?
Yep, might do another one next. Let's see if you can switch to the other side. Yep. A little bit. Okay.
I think it would be different if I was actually
Yeah, in a
like better,
chair, uh-huh.
like really, because them benches in the doctor's office, you not really be high.
Get high. Lucky you got something on it.
Yeah.
Okay, so now we're gonna finish with the cranial nerve. So I'm gonna basically give you some instructions. Just follow me as best as you can,
Okay.
but you can remain in that seat. So first, I'm gonna have you smell. Close your eyes, and then I'm gonna let you. I need you to describe what you're smelling as best as you are capable.
Okay.
So go ahead. Smell. What does it smell like?
Like strawberry-ish, cherry-ish.
Yeah.
That's it.
It's good. Okay. And now I stand on the other side of the room. What color is my, oh, you can open your eyes now. What color is my stethoscope?
Pink.
Yep. Okay, then I'm gonna have you follow my pin light
All right.
in all 6 directions. Okay, so next I'm gonna have you clench and I'm gonna push down on your jaw. Ready? Good. Okay, and I'm gonna have you make, I'm standing right. I'm gonna have you make 7 different facial expressions. Ready? So first smile,
Oh,
frown,
take.
show teeth, squint your eyes, lift your eyebrows, and then purse your lips. Good. Okay, so I'm going to stand on the left side of you,
All right.
on my best of my ability, and whisper where you just try to repeat it, okay?
Okay.
Oh, you gotta close, sorry, excuse me, bad instructions. Close your right ear. Yeah, okay, now I'm gonna repeat it.
Okay.
You ready? Perfect, okay, next one. Close your left ear. Now I'm just gonna go downstairs a little bit.
Okay.
But as a distance. Okay. Good. Okay, I'm gonna have you open your mouth and say ah. Stick out your tongue. Say ah. Good. Okay. Okay, so now I'm going to put my hands on your shoulders and you're just gonna shrug up. Okay, so be relax first. Now try to shrug. Good. Okay, and I'm gonna put my hand on your right cheek, and you're gonna look towards that right cheek.
Mm-hmm.
The other one, this one. There you go. Opposite. Push towards it. Good. Okay. Okay, and then last, now you stick your tongue out and move in all directions. Good. All right. Now, before I wrap up with this assessment, do you have any questions for me?
Nope.
Okay. Well, it was nice working with you.
All right. Pleasure.